Go ahead and get started. We're really excited to have Dr. Langston with us today. He's the managing partner and CEO at Urology of Virginia. He's also a practicing urologist and longtime advocate for clinical efficiency in the urology space. My name is DiAntonio. I'm in charge of the market expansion efforts within urology at EngagedMD, and I'm excited to be the MC of this discussion. Today, we're going to talk about the shifting landscape of urology care, how clinics can modernize without overwhelming their teams, and where technology like EngagedMD fits into the future of patient engagement. Again, throughout today's discussion, feel free to add your questions down below in the chat feature, and we can bring those up in real time. So to set the stage, in the current state of urology, we're really seeing that patient volume is growing, workforce is shrinking, insurance costs are going up, yet reimbursements are fixed or sliding downwards. So there's this real need for clinics to be scrappy, to be innovative, and think about clinical efficiency. Dr. Langston, as a business leader, I'm curious, in your opinion, on what some of the biggest pressures are in your practice today, either clinically, operationally, or even administratively.
Sure, Chris. Well, hey, thanks again for having me for this. And I think it's a really great opportunity to have a conversation around all these topics of efficiency and what does the future of what we do kind of look like, because I think what's clear is it can't look like the past. We can't continue to practice in the future the way that we historically did in the sort of 80s, 90s era. And how are we going to innovate? And I think technology obviously is going to drive that. And this resource that you all have put forth is such a great example of what we can be doing to think outside the box. Now, to answer your question, with regard to what we're feeling, obviously, I think almost all clinics around the country will be feeling something pretty similar, which is an overwhelming patient volume as the baby boomer generation comes to an age where they're needing more of our services. At the same time, a shrinking number of providers, specifically MDs, and having to rely more and more on APPs for sure in the mix. As well as more complex care. The complexity to any given diagnosis now is orders of magnitude more complicated than it was a generation ago. And so how do we blend all that together, I think really is the challenge.
That's a really good point. Based on some of those considerations, I'm also curious, through the lens of looking at your patient population, how have you seen the evolving patient, either their needs or their expectations, evolve in recent years as well?
Yeah, another good point, which I think we all kind of recognize Dr. Google as that buzzword that folks are able, information's at our fingertips now, and when it comes to healthcare, people want to know as soon as they can information about their situation, their diagnosis, so they are going to seek that out. That's what we know. And then are we going to be the resource for that? Or are they going to just go find it on Google and find a mishmash of content that we may or may not really want them to be consuming? It may or may not be accurate to what we are doing locally, and we may then have to spend time. I know a big topic we're going to talk about here just is time. Are we going to then spend time unwinding whatever thoughts they had coming into the visit or along the pathway that we've set for them? Are we going to spend time with our staff and with our providers having to reorient them to the type of care that we're looking to provide? Or do we just want to be at the front line of that, giving them that information up front so that it saves time down the line having to redirect?
And thinking about some of the things you just mentioned, different pressures that are bubbling up, expectations and needs that are growing, as it relates back to a clinical practice, from your perspective, what are some inefficiencies maybe in operations that you've seen with maybe the traditional patient journey as it has existed?
Yeah, so I don't know how others feel, but to me, in my first few years of practice, and I am now a little bit reduced in my clinical practice because of administrative work, but for the first decade, I wasn't. And you'd find yourself, we all find ourselves repeating the same talk for patients 10 times a day, whether it's anything from, vasectomy consult to you have a kidney stone, what now? To you have prostate cancer, what are we going to do about that? To, you name it. The fact that we are at a point now where we can't really afford to spend the time going in and repeating that same talk track to a patient multiple times a day. And so I think what we'll get to in this conversation is anything that we are repeating multiple times a day, that is such an inefficiency that we could address in a better way. I think also, the heterogeneity of care, when patients don't have the guaranteed same message every time, that's going to lead to uncertainties with the staff. So patients are going to call in and be asking questions because maybe this patient heard something a little different than that patient. And so then the staff's going to have to kind of work with, what do I tell them, or what resources do I give them, or how do I point them toward the information that they need? And so the more we can homogenize what people are hearing, give them a resource that will allow them to hear it again and again and again so they can kind of seek their answers there versus having to call in and talk to somebody, and then also standardize so that our staff knows what the patients were told and what they should be expecting and what the next steps are, kind of in a very pathway driven way at care. We're going to save time for staff and providers.
And a number of the challenges you just mentioned, time savings, standardization, these things are going to help with impact. How have these challenges impacted frontline staff, MD teams, overall clinical operations? What do you think the downstream impacts are?
In the traditional model, kind of as we are trying to crawl out of that, I think that it's more staff are required. Again, there's so many mixed messages and mixed signals going all over that we really need to try and remove that aspect of inefficiency. So I think that's the biggest, when it comes to the staff. I think for the providers, we all grew up in that model of just, it's okay to repeat yourself 10 times. And so I think it's us kind of saying, well, I don't personally think that makes a lot of sense anyway, but I now know for certain I don't have the time to do it. And we can't continue to practice in that traditional way. So how are we going to care for the population? I mean, our situation, again, I think many around the country, we have hundreds more patients, referrals coming in on a weekly and monthly basis than we can care for. So we have got no choice but to figure out how to be more efficient to actually provide the care for the community.
And I think that really builds the case for modernization. I know that over the past few years, a hot topic, and oftentimes what we're seeing at a bunch of these urology conferences that we're all attending are these breakout sessions that are around modernization, clinical efficiency, automation through tech, et cetera. A lot of these big buzzwords. But I'm curious, in your opinion, Dr. Langston, when we think about modern urology care, in your opinion, what does that look like in practice, both for the patient and for the care team?
Well, I think the human side is not going to go away, nor should it, right? So we have to really figure out how to augment the provider-patient connection in a way that is modern, but yet doesn't take away the sort of traditional aspect of that relationship, which I think has to be there. And so what I think, as we've kind of talked about, it really is going to be about solidifying and then streamlining the information the patient receives about their diagnosis. One thing that maybe we could touch on briefly is the role of advanced practice providers, or APPs. So PAs and nurse practitioners, I think across the board, people are understanding that they serve a critical role in the care process, in the pathway. Well, if a patient is seeing multiple providers, or just it's uncertain how they may trickle through, then that introduces a lot of uncertainty about what messaging they'll receive. Are they on pathway? Are they getting the standard of care that we, as the practice leaders, as the physicians, really want them to receive? And I think one of the things, and we'll talk more about EngagedMD, but one of the beautiful things about that is that we can get the patient content about their diagnosis, about our approach to their treatment plan, et cetera, right up front. And then, and that, that's new, that's technology, that's not the human touch. But then as they work through the process with their, interactions with our team, whether it's a PA, whether it's an MD, whether it's a nursing member of the staff, if we're all kind of marching in the same direction and they're hearing that consistent messaging, that gives them a lot of reassurance that they're receiving the right care. And it also kind of giving them content that they can go back and review means that they don't just have that 10 or 12 minutes of really rapid pace time with a provider to gain information. They can actually refer back to, they can send it to their family members to watch, et cetera. And so they've always got the information at their fingertips. And so even though we've moved away from the traditional approach, which is I, as the doctor, would meet the patient on day one and walk with them every step of the way through to their treatment and then beyond, I can tell you that's not what we are doing at Urology of Virginia. Now, we really have embraced the APP model and integrated them in some ways I'm very proud of, but it's a little uncomfortable for people that want to stick with that traditional model. But the fact that we can standardize not only the pathway, but also the information that the patient has received along the pathway, so that if you're meeting the patient toward the end here and they've already been through, what they've received. You don't have to question, did they get the messaging that I would want them to get? You know what messaging they got because they've been given a standard sort of content that we've all agreed on. So I think that really allows to keep this, let me summarize by saying it allows us to keep that human touch all along the way. In fact, maybe more of it, because as we know, PAs, nurse practitioners have maybe more time to spend with patients, are more available, but it doesn't compromise on the assurance that the patient's getting the right care that we want them to have.
I think those were a number of good examples and a really good segue into your clinic's approach. Would you be able to share a little bit more? We've been working together now for about a year and a half, I believe. I would love if you could share how Urology of Virginia has incorporated EngagedMD into some of the different workflows that are going through your system.
Sure. I'd be glad to. And I am really excited about this just because I think it is really genuinely meaningful. And I think that those that are able to join in on this will hopefully understand and agree. I could think of a few offhand. One, just a simple one, is vasectomies. I know we've talked some about that. And vasectomy consults, it's the same conversation every single time. And you want it to be the same, right? I remember when I was doing them earlier in my career, gosh, you'd leave a sentence or two out here or there, and you'd feel bad, like you want the patients to get the exact same message. So, we standardized that. So as a proof of principle, we worked with EngagedMD. We came up with content that men would see before their initial vasectomy consult. We sent that information to them. And then just to prove the principle, because I was so sure it would work, I scheduled 55 patients on a Saturday, and I went in and saw 55 new patient consults for vasectomy in one day, because every single one of them had watched the video. And every single one of them, when I walked in the room, I said, "Did you watch the video?" "Yes." "Do you have any questions?" "Nope." "Ready to get this done." And it was pretty much, I'd ask a few questions about their medical history, but those visits were very quick. The patients were very satisfied. They didn't want more time with me. They were happy with the 5 minutes that we spent, because they had already been informed about, everything that they needed to know about getting that procedure done. So that was a really, cool kind of proof of principle, because some people told me it couldn't be done, and I wanted to prove them wrong. But so that's number one, and that's something very simple and kind of works well for that. Another one that's very important to us is our care for prostate cancer patients, and that's a kind of a situation where when you break the news to somebody about them having prostate cancer, they don't hear you, right? We know that they are not going to walk away from that with anything other than the shock of the fact that they've been told they have cancer. Maybe they picked up on a couple little details, and so I think that's a place where we could really improve the quality of care by packaging together a bunch of information about, okay, you have prostate cancer, now what? Because that's the classic one that they go out and start Googling, and get who knows what kind of information off the internet. So not only do they even have a chance to see this content, as soon as possible. We're not breaking the news to them by sending them an email, but once they are aware of the diagnosis, we get them the information as soon as we can, so they can process that, digest it. Then when they come in for their visits subsequently, those are more meaningful visits, because they've already thought about it, they've already watched it, they've already seen the talk track. So we don't have to spend time doing that. We go straight to the questions and actually more time connecting on the human side of things, because we're not having to try to churn our way through that talk track. So that's been really great. In the cancer center, we've done that for prostate cancer. And I think, Chris, you could say more. I mean, I think it's in the works for bladder, kidney, and others. Um, and then another one that I could speak to quickly is BPH. And so we've had some changes in our staffing model around that, and that's a place where we rely really heavily on APPs. And I can tell you, it's just amazing. I think the way it's working. We have a PA that does the cystoscopy and transrectal ultrasound for volume of the prostate. And then based on that information, she's not comfortable, nor, would a lot of doctors be comfortable having her decide what surgery the patient's going to have. And so she does that, gets that information, puts it in the chart. I've got great images. I've got an accurate volume. And then we created bundles of small, medium, and large prostate with and without median lobe. And we have different bundles that the patient would receive based on what she sees when she's in the room with them doing the procedure, that would detail out the potential procedures or operations that they're eligible for based on the size and shape of their prostate. So based on those bundles, which are EngagedMD, we put together with the team, we then send the patient that bundle. They watch that, they see all the things that they may be eligible for, and then they have a visit back with me, for instance, where I'm not having to start from scratch and tell them about all 4 or 5 things they might be candidates for, the pros and cons of each. They've already watched that. It's tailored to their specific situation. And so we jump straight into, what do you think? What are your questions? What are your values? What are your priorities? And then we're able to kind of get moving with a treatment. And so it's oftentimes, as I think we all experience, PAs and nurse practitioners are doing a lot of the workup of BPH up to the point of needing that kind of workup where they would get a cystoscopy and ultrasound. And so a lot of that pathway is now able to be APP driven, right up to the point that the physician must be involved, which is selecting and then and performing a procedure. And so, but again, I feel complete certainty that the patient has every bit of knowledge, because in addition to those surgical bundles that I talked about, from the very beginning of a patient being diagnosed with BPH, they're getting a different EngagedMD package that walks them through what is BPH, what is the prostate, what happens as you get older, how does this work, what does this mean to you? So they've already got all that content, and we can rest assured that they have a really good standardized talk track on that information, and then it works straight through all the way to surgery. And again, it's been great for us, decreasing our wait times both to get into practice and to get surgery. And it's just been a really good use of technology to augment the process without compromising care.
Thanks, Dr. Langston. Those are some really good stories. I'm glad that you mentioned the vasectomy Saturday backlog story. That's one that at least our team internally likes chatting about. Definitely a funny one to take on and tackle. I've always also found that as we've deployed across Urology of Virginia, we started with vasectomy, and then we've moved on to stones and BPH and these different journeys going all the way up to some of the cancers. I've always found it interesting of, depending on what we're educating the patient on, what is the best value for that module. We look at vasectomy. Physicians usually have a pretty tight talk track around that already. So it's not necessarily about the time savings there. Maybe you're still shaving minutes, but then you're also getting the standardization. But then as you start going to some of these other topics, like the prostate cancer, as you mentioned, the patient hears the word cancer, and then everything goes in one ear and out the other. So kind of the topics that require more hand holding, maybe it has higher emotional impact. Cancers are really distressing topics. The need and the time savings kind of goes hand in hand with what you can kind of achieve there. I'm curious, in your opinion, what surprised you the most about introducing digital education into the practice?
Well, I think it's surprising. I mean, we're used to dealing with patients that are sort of at an older age and elderly population, but I think there's been really good uptake of that. Everyone's now very, very connected. Very much into whether it's social media or whatnot, and so there really is the potential for good uptake. And I think that EngagedMD has been iterating to improve ways that people can get access to this. So now it's not just an email, it can be a text message and other ways. So I think as we break down those barriers to accessing the material, people are very comfortable even in their 80s, using their phone or their computer, accessing the modules, watching the videos, which again, are done in a way that's low stress for them because they would rather, and I think this is surprising to answer your question, they would rather sit in their home and consume the content at their pace, than be in the office sitting in front of the doctor, kind of in a sort of pressured speech, kind of rapid discussion that can only last 10 minutes, et cetera. And I think that's surprising and bodes really well for the future.
We do have two questions from the chat that I feel like are good segues here. The first is, how did you find older patients are interacting with technology and tech tools in general?
Yeah, so I think that I kind of hit on that, but it was surprising to me. I do think accessing it in multiple ways, which is relatively new thing that we've introduced, is going to be helpful. So it doesn't have to just be email, link on it can be text message, and you don't have to have an account. They're pretty easy to just access directly. You click the link, it's going to pull up the content. There's not multiple steps and everything. So it's great. And then, of course, they can forward that to their children who are asking questions about their diagnosis and et cetera. And then everybody can get the same story, the same content. And you're not burning time, backtracking, redirecting, relitigating kind of the conversation because it's all been very clearly spelled out.
That's great. And then the second question that we received was there any resistance to rolling out a new technology tool on an overburdened staff? What was your experience there?
Yeah, and that's a great point because the ultimate goal of this, in fact, and I don't talk or think about it as much, and I think Chris, your team does a great job of focusing on how this is really beneficial to staff, and it will save them time in the long run. To the question, it may be a little blip up in the beginning, but again, a simple web-based platform to send out these communications. In fact, you all actually preferred it really integrate into the practice management and EMR systems to do that. We haven't done that just yet, so we are still kind of in the most manual version of it, and it's still not that big a deal because once the staff get the hang of it, it's simply logging into the web portal, making sure the patient's name and phone number and email are there, hitting send. So and we rolled out one thing at a time. We started with vasectomy just because it was so easy and isolated. Built a use case out for that, proved that it would work in a pretty straightforward way, and then just kind of ramped up from there.
Great. Thanks for that insight and kind of reflecting on how we've been adopted into your practice. I know we've been really encouraged by some of the metrics that we've been collecting over the period that we've been working together. We've got higher patient comprehension, we've got reduced consultation times, improved patient satisfaction scores. These are all things that we track in the system as patients are moving through their allotted education. In your opinion, I'm curious, what outcome has been most meaningful to you as a physician and then also as an operator?
I think most meaningful to me is that what it's done for patient access. So we care deeply about quality of care, and you can have great quality of care in this one individual, but if 99 are out there in the community waiting, I don't think you could say you're really succeeding as an organization. And so both for vasectomy. For sure, that had a many month wait to get in, but we were able to reduce that way down through use of this process. And similar with BPH, for sure, we cut way down on our wait time. So those are really meaningful to me. Harder to measure are the patient satisfaction and sort of security with what they're going through. And I think that is really improved as well, maybe with other disease states like prostate cancer, et cetera. But harder to measure. So I think those have been the real meaningful things.
Wonderful. Thanks for that insight. I've got two more questions. If anyone in the attendee room has a question, now's the time to ask it before we close up. Before we get there, I'm curious on just broader reflections of bringing technology into the urology world. If you are advising other practice leaders on how they would modernize their journey, where they should begin? What should they look at tackling first? What would your advice be?
Good question. I really think that you have to first realize that we can't keep doing things the way that we were. So with your physicians, with your leaders, you have to realize that we must do something different. And then I think the first key to any of these things being successful is a degree of standardization, right? I mean, a tool like EngagedMD, no question, it's a great tool. Whether it's right for your group or not, depends. And the way to get to a place where it is right for you and any of these technology solutions are right for you is you've got to get on the same page and standardize your approach to a disease state, your comfort level with involving APPs in that, your comfort level with maybe having less touches on the patient or a little bit different pathway because you're letting technology augment that so that you get to the same result. You got to maintain your principles, but always be willing to reevaluate your processes. I heard that just the other day. So that phrase, and that was a definition of what a good entrepreneur is. And I know we as physicians certainly are not probably thought of as entrepreneurs in our approach to life, being very scientific and methodical. And so, we do have to consider that we're going to be left behind if we aren't willing to rethink how we do those things. So I didn't answer your question at all with relation to technology, like use this platform or use that platform. But I think it's really just about getting your group first and foremost to a place where those things are going to have an impact because you are open to them. You realize you have got to figure this out and adopt them one way or the other. And you've standardized your thought processes enough to be able to embrace some of these things and let them work, right? They work, but will they work for you depends on if your group is set up for it.
Yeah, I actually completely agree with that response. If you can set up the piping right, get the plumbing right, then you're actually really able to maximize whatever tech tool you can put on top of it. Last question for you before we wrap up today. Where do you see technology, automation, AI, any of these tech tools that are flooding the space? How do you see that changing, influencing urology care over the next 3 to 5 years?
Good question. I think on the front end, you could say things like, helping augment your call center. You could obviously in patient interactions, the AI-based scribes, which are already pretty good and live, things like scheduling or some of that sort of stuff on the back end, your prior authorizations and whatnot, and really taking over a lot of the billing processes. But in the end, what's in the middle there, which is again the doctor-patient relationship isn't going to go away, and that can't be replaced with technology. And so the question, and I know we really have almost kind of skirted around the role of EngagedMD in some of these ways, but again, this is really good, customizable, targeted content that your group is able to deliver to your patients, and again in a way that's accessible and usable to them. That's going to get them everything they need from the technical medical standpoint to understand what is going on with them and what you plan to do about it. And that's actually the technology is going to give you back more time to actually do for us as physicians what we signed up for this to do, which is spend time with people and see them get the care that they need, and not and not feel like we're spending all our time in all these other ways, such as documenting a note or fighting a prior authorization. So that's where EngagedMD fits within the patient journey part of it. All those other things kind of on the either end of it, they're all going to serve as hopefully really good solutions to give us our time back to do what we signed up to do.
Well, wonderful. I really appreciate that insight. Thank you, Dr. Langston, for sharing your experience with EngagedMD and some of your insight into the market and where technology is going. And for everyone for attending today's session during your lunch break. Before we close, any other closing remarks, Dr. Langston? I appreciate all the insight that you've been giving. Anything else?
No, I do appreciate everyone being involved in this. Again, I really do believe in EngagedMD as a solution. The only thing I didn't kind of maybe mention that I would have wanted to is if you're going to use something like this, use it as many times along the way as you can. So not only are you getting it to patients, but you're also using it as accessible from your website and content there. So you're populating that out, and they're getting the same messaging there that they would get as the individual patient receiving. So bringing this service into your practice can serve the practice in a lot of ways, even beyond kind of the specific reference points today of getting these modules out to patients. It really can augment and change drastically your information that your medical information that you have accessible, patient-facing information. And you know, that's a lot of work to do on your own. It would be an incredible amount of work to be able to bring all this in. So it's great to have a partner that can do that with us.
Well, thanks again, Dr. Langston. Thanks, attendees, for joining today's session.